family practice, so we just want to make sure that you know that we are here for all of your healthcare needs for your whole family. We do from pediatrics all the way through chronic care management and elderly and those things. So we're here for you. And we also try, it's important to us not just to get our patients healthy if they happen to be ill at the moment, but to also keep people healthy and to keep the people of our area, our region healthy. And this is Colon Cancer Awareness Month. And colon cancer it's the third most commonly diagnosed cancer, and it's the second leading cause of cancer deaths. And so it is important. I know it's uncomfortable for some people to talk about, or it's not one of those things we really want to think about, but it is really important. And the secret is screenings. And, the American Cancer Society recommends that age 50, that everyone starts getting screened. So, we want you to get your screenings. We're there for that. Some of those you can just kind of take home and do in the privacy of your own home. So it doesn't have to be this big, uncomfortable, ordeal. But it is incredibly important that you speak to your provider and start getting those screenings to keep you healthy, because early diagnosis is, it's the key to staying safe.
You mentioned the home test.
Yes.
It seems like I've seen a commercial recently,
right.
and probably because of the whole, colorectal cancer awareness month.
Right.
Regarding, screenings at home for
right,
colon cancer.
Exactly.
I was like, I'd never seen that before.
No, so we do have that. I mean, you can come in, and we can give you that kit, and you can go home, and and then you can either bring it back to us. Some of them you mail, so it can work different ways. But we'll work with you to make sure that that's 100% comfortable for you to do that. In whatever way works for you. But those screenings are indeed, the key that we're wanting everyone to get in.
What are the costs for those?
That would be through insurance, and I do not have that at the top of my head. I know the kit itself is not expensive at all. It's maybe the testing of those, but those things are indeed covered by insurance because it is so important to do. And again, at Community Medical Clinic, one of the things we are proud of is that we do offer a sliding scale fee. So if there is, an inability to pay, or if you have poor insurance coverage or those things, we are there to work with you to make sure that you get healthy regardless of your ability to pay. So please don't let that in any way hinder you, because that's what we're here for, is to make sure that everyone stays safe and healthy and that we keep you that way.
All right. And do you have like the statistics on colorectal cancer? That is hard to say.
It is. It's quite a mouthful, isn't it?
Do you have any information on that? How many cases per year?
Let me double check here. I have quite a few statistics. I mean, I know that it's a very slow developing thing, which is why early diagnosis is important, because it's something that usually develops over a period of 10 to 15 years. So if you start, screening early, we have a good chance of catching that incredibly early and being able to solve that problem, and to keep you cancer free. Only about 2/3 of the people who are 50 or older who need to be tested, are getting tested. So we really want to up those numbers a great deal. Let me look for the number you were wanting.
Well, that's okay.
Here.
I just didn't.
Right.
Maybe you might have had it right there. With
no,
you.
I will as soon as we talk about something else. I'll
sure,
find
you'll
that
find
one.
it. That's fine. That's fine. I just thought maybe you had it. And the point is that it's important enough that they're doing commercials now about it. And
well, like I said, it is the
third
third most commonly diagnosed cancer that there is, and the second leading cause of cancer death.
Right.
So it is very important. I mean, the numbers are there.
All right, Dawnia. So we're gonna work on over 50s getting those screenings. What else?
We also have in the area. We are having a rise in hepatitis A. I know in the Christian County, in that region, there's been over 40 cases that have been documented. So please give us a call. Come in. We do have the hepatitis A vaccine. Please come in and get that vaccine. Speak to your practitioner and protect yourself. So, I mean, that's very serious, and we want to make sure that we are protected. And, once it's in a region such as that, you've got, people working in the food services, those kinds of things, so it can spread very easily. So again, we're here to keep you healthy. So whether it's the colorectal screening, speak to your provider about that. Whether it's the hepatitis A, we want to make sure that we get you in and keep you healthy.
And I know there was a recent story of an employee at a school.
Yes.
Locally that was diagnosed with hepatitis A. So talk to us about hepatitis A. What is it? Where does it come from? How does it spread? Well,
again, hepatitis A is spread through, again, and I think that's the part that has so many people concerned about that. It can be if someone has it and isn't washing their hands well, or those kinds of things, you can get that with people from food services, that are preparing your food. So, I think that becomes a big issue. It is more easily spread than some things are.
Is it airborne? So it's not airborne, then it must be a contact.
Yeah, for that, I don't know the entire
how it's spread. Okay.
How everything is spread.
Okay. Oh, I'm sorry. I thought you were looking for something.
Right.
Okay.
No, sorry.
Okay. So, but what can we do about it? How can we prevent getting it?
You need to come and get the hepatitis A vaccine. That is, obviously the best way to do it, to protect yourself from that, to protect your family, and that's important. And we have those vaccines. And again, our goal here is to keep you healthy. So we want you to come in, see your provider, get those checkups. Make sure that you're getting the age-appropriate screenings, whether it's for colorectal, whether it's for breast cancer, for any of those things, and that you stay up on the vaccines that are available to protect you from things that are out there.
Is that vaccine something we should be getting yearly? What do you know, the hepatitis A vaccine?
I know it comes into, you get one, and then 6 months later you'll get another, like a booster, and then it lasts for quite some time. I'm not sure quite how long that lasts, but I don't think it's not something you have to do yearly. No, it is not.
Okay. And do you know how effective they are? Are they?
Yes, they're extremely effective.
Okay. All right. So if we do get vaccinated, then our chances of getting hepatitis are
very, very,
hepatitis
yes.
A.
No, vaccines work. They absolutely work.
Well, I know that there's some with the flu vaccine that they're not necessarily.
Well, the flu is different. The flu is something that kind of evolves and changes, and there's numerous strains. And a lot of times they'll say, oh, the flu vaccine didn't work that well this year. Had you not had the flu vaccine, you might have been a great deal sicker. So sometimes it protects you more than I think people may think.
I see.
That it did.
Okay. And we're still, speaking of the flu vaccine, we're still in flu season.
We are still in flu season. We do have flu shots available. Those are for $10. Again, if it doesn't happen to be covered by your insurance or those things. So no, please, make an appointment to come in and to get these vaccines and protect yourself and your family.
What other types of screenings and vaccines and such are commonly provided through the
Again, we
clinics?
are a full-service family practice, so every type of screening that you need, we're on top of it. That's what we do. And because we're an FQHC, which is a federally qualified health center, we have a lot of quality measures that we work very hard to make sure that all of our patients are getting the screenings that they need, because then we have to make sure that we're doing everything that we can to keep that status, that we're doing everything that we can for our community to keep them safe and healthy. So, if you want to make an appointment and come in, we also, we're available at walk-ins. But if you wanted to make an appointment for a good checkup to come in, and your provider could talk to you and get you on a good schedule for every screening that you need, all the vaccines that you need. And again, it's just important to keeping you healthy and to keeping you strong, because once it's so much easier to keep you healthy than to
get you there.
Than to get you back once you're sick. So we really want to promote that, again, with the colon cancer awareness. Again, get that screening early, so that if there happens to be something, you can detect it early, and the success rates are amazing when we can detect it early.
Mm-hmm. What is next month? Do you know what recognition we're?
Off the top of my head, I do not.
Yeah. Okay. I didn't know because I'm sure we're at the end of the
No,
month. I thought maybe
there
we were
are
gearing up
awareness
for
months
every month. And
every
sometimes
month.
there's more than one a month, right?
There are.
I think this month was also didn't we also touch
It was
on diabetes?
National Nutrition Month.
Okay. This month?
This month was.
I missed that.
No, this is
I missed
National
that.
Nutrition Month, so absolutely. And we do have a health coach. We have a couple of health coaches, actually. So if you're wanting help with your nutrition, with your diet, we have someone there who can work with you, throughout and help you build a plan and work with you on that.
So the health coach, you say build a plan. What kind of plan did they help with?
They help with everything. If you have a chronic condition, let's say, if you happen to be overweight or if you have high blood pressure or cholesterol issues, any of those things, then, they will work with you on what is good food and what isn't good food, because sometimes I know there are. I've told this story with my mom was diabetic, and she would get up in the middle of the night if she was hungry and eat a banana and a granola bar, which she thought was healthy, and it sounds healthy, but for a diabetic that was not healthy. So just making sure that you have indeed some of those. Some of that knowledge base of what does and doesn't work, what is healthy, those are the things that help. And they're there to work with you through that whole process.
And your nutritionists, do they specifically work with meal plans, though not exercise plans? Do you have anybody to help with exercise plans as well?
We will help network you with someone, for any of those needs that you have.
I see. Okay. All right. And
certainly, and we work with different people, whether it's the health departments or those things, whether it's a health walk or any of those kinds of things. So we, like I said, we're a full service family practice, and we go to to great efforts to keep you healthy and to work those things all to your benefit.
I see. And I see Keisha just came in to join you. She was scheduled to join us this morning, but I understand, Keisha, you had a little trouble with your garage door this morning.
Yes. You can be locked out of your house, but you can also be locked in your house because the garage door was wedged closed, and we had to move things within the garage, and thank goodness there was not a vehicle on the other side, so it took us about 20 minutes of moving things to be able to get the vehicle out of the garage.
Oh,
my garage door you can't get in or out of it.
So I'm confused. How did you get the car out?
We didn't have it's a 2-car garage.
Oh, I'm with you. Okay. So the other side you could get out.
Yeah, we had to move 4-wheelers and tables, a canoe.
And then try to get good golly. So
it's been an interesting morning.
So for those of you just joining, we have Dawnia Green and Keisha Fulcher with us from Community Medical Clinic. Dawnia came in, and I didn't recognize her. I met her once, and I was like, oh, I don't know who this is that's supposed to come in. She looked like she was ready for an interview. And I was like, I don't know who she is. I don't know what I'm supposed to be doing. So she came in and she told me, I knew Keisha was supposed to be here this morning from Community Medical Clinic. And she said, I'm here for Keisha, or I'm here from Community Medical Clinic. I was like, oh, okay. I thought Keisha was coming in. She said, yeah, but she couldn't get out of her garage.
I'm so sorry.
Like,
I am.
No, that's fine.
I had a problem with it last night, and we got it down, and then I couldn't get it back up this morning. So I will be calling someone to get my garage door.
So if you fix garage doors,
we cover lots of stuff this morning on the radio for Community Medical.
Right, I know. Yeah, Dawnia said she's like, I was just about to get in the shower when my phone rang.
Yeah, I know, and that's with living a distance away, that is one of the difficulties about it, and.
Right, because you ladies come from Hopkinsville, right?
No, actually, I'm from Greenville.
Oh,
yeah,
okay.
I live in Muhlenberg, and so
I knew you made a trip, and I appreciate that, by the way.
Yeah, I'm sorry. Like I said, it was just challenging to get the other vehicle out of the garage, but that's the blessing of having good coworkers, because Dawnia is our marketing and communications director, and she actually supplies me with a lot of data and statistics for the different awareness months, and so I just called her and I said I'm going to get there, but at what time I can't really tell you. It depends on how long it's going to take us to
move canoes and 4-wheelers.
to get the vehicle out of the garage. Yeah, we had been working on about 10 minutes when I called her, and I thought, other than probably getting a speeding ticket, I don't know. I don't know how I can get there. We joke all the time because we are regional that it would be nice if we could afford a helicopter, but it would have come in handy maybe this morning.
Right.
But if people have seen me drive, they don't want me flying.
Oh no. Keisha, I do appreciate you going to all that trouble and making the trip in, but just call me and say, Misty, I'm not going to be able to make it this morning. My garage, and I will understand.
We want to follow through because there's a lot of information that we need to get out to the public, and I do have on my blue today for it's colorectal cancer awareness month. I've listened to you guys as I was coming in. I know you've touched on it already, and so this is dual, maybe triple purpose blue today because it's colorectal cancer awareness month. You got your UK blue, or some would say Murray Racers blue.
Yeah,
so blue is a popular and good color to have here at the end of March for
I see you got
March
the UK
Madness.
earrings.
Yeah, I'm a UK alum, so I had to put the earrings in, but it's multi-purpose blue
there you
today.
go. Okay.
But we do have multiple screening options that you can come in. Have you talked yet about the grant?
I did not.
Okay, I want to touch on that.
All right.
Because we have received a grant from the Department of Public Health that actually came through the CDC for providing colonoscopies. And we won't be starting this until July, but I wanted to get some of the information out to the public. We're going to be working with those that provide colonoscopies in the area, but if someone is uninsured or underinsured, meaning that it's not going to cover all of the services that they need to have a colonoscopy, then we will be able to provide that. We're working on contracts right now with individuals to provide that. So starting in July, we would be able to provide that probably for 20 to 25 individuals per year. It's a 2-year grant, so it's for 19 and for 20. And we're really pleased with that. One of the other things, you don't necessarily have to have a colonoscopy. There are other screening options. There's a fit test, and of course the Cologuard. You see those commercials on TV where you can do the kits. You can do the kits, and depending upon your insurance or your own individual health recommendations. Part of that's age related. Usually they say 50 and over, but they are dropping it down to 45 for some individuals if and even younger than that if you have a family history. I have a very dear friend right now that is age 40 that is fighting colon cancer, and it was stage 4 when they found it. And that's the unfortunate thing with when it's a younger person, is that a lot of times it's pretty advanced before it's found. Now, but the colonoscopy, the good thing about that, I can say that I've had a couple. It's, you can do it. You can, it's not something that everybody likes to talk about, or it's pleasant, but I did have a polyp the last time, and so they removed that, and I'm good to go for 10 years. That's the thing. They say if you go in and you have it done and you get done what you need to, then you don't have to have another one for 10 years. Well, so I'm good for 7 years now. Right. I had it a few years ago, but and that's the good thing. And then when you get up in your 70s, then they don't recommend it usually beyond that unless you're having some types of symptoms. So for that 20-year time span, a decade, then you need to have at least 2 for your average person. You have a family history, start sooner, and they may do it more frequently depending upon your own individual needs. It's not that bad. It's come a long way from when I had my very first one, because I do have family history there. And, so you need to talk with your provider and make individual assistance, they'll make individual decisions for you, yeah. And I heard y'all talking about the Hep A. And
yes.
Yeah, so, we've covered a lot of things this morning, but that's good because we do need people to come in and get those vaccinations. That was one that I had never had before. So I myself, our employees, anybody, we've offered that free of charge to our employees, and then, we do provide that through the Vaccines for Children program. If you have a child that's on Medicaid, I know some of them are worried because of school systems and involvement in children. So, we do have that program available. It's of no charge. So for kids that have Medicaid, with the private insurance, we can do one of two things. If we don't have it on hand, we can do an order where it'll go to the pharmacy, and a parent can go and pick it up for their child and bring it back to us, and we can get it. And that goes for any vaccine. So if you have private insurance and we don't have it on hand, we can do an order, and you can go to the pharmacy and pick it up, and we can then administer it if there's something we're low on.
Okay, so the theme for today, vaccinate and screen.
That's exactly right. And Dawnia said that on the way in. That's really what we're all about, is if you can do good prevention for population health, then you're not in a crisis or managing. And, this is one of the most preventable. Colorectal cancer is one of the most preventable. And like with the hepatitis vaccines, they are, almost 100%. If you get them and effective, yeah.
Okay. All right, Dawnia, Keisha, I appreciate you all coming in this morning. Community Medical Clinic, that's great services that you provide, because we do need to think about things that we don't want to think about, and we do need to get ourselves screened, get our vaccinations, and be prepared for things that could happen.
Yeah.
Do you, Keisha, Dawnia couldn't remember, do you know what next month's Awareness Month is?
In April, I know that it's Child Abuse Awareness Month.
And it's alcoholism awareness.
There's multiple.
It's multiple.
And even like this month, we didn't mention
screening.
that yesterday was Down Syndrome Awareness Day. And we did our socks. I don't know, you can check us out on our Facebook. We all wore our wild socks for that because of 321, chromosomes. Talking about that awareness and, maybe some health issues that go along with Down syndrome. There's a lot of cardiovascular issues at times, and of course, having formerly worked for the Penrose Center, I know we have one of the older Down syndrome populations in the United States, and the reason is because of providing good care. Knowing people, taking good care of people, and that's something we don't really think of, because sometimes there is a shorter life expectancy, but because of good preventative care and taking good care of people, then we have one of the older populations. And you think because we're small and rural that we don't excel at things, but that's not true. There's a lot of things that we excel at that we just don't get out there and let it be known. So
right.
I wanted to mention that, and we'll come back with more stuff next month.
Yes, maybe you'll be able to get out of your garage next
It's also
month.
National Autism Awareness Month.
Right. I guess I was saying, was there a specific screening on the books for next month? That's what I was asking.
We'll probably touch on several things again.
Okay. All right. Well, we'll have you back next month. We'll talk about that. Thank you, ladies, for pushing through this morning and being in. I appreciate it. Hopefully next month will be a smoother ride
I'm really hoping so. I've actually, it's been like this. Dawnia said, you may need to start this week over. I've had two screws in my tires. It's just been one of those. But
goodness. Bless your heart.
Like you said, push on through.
Push on through. Thank you, ladies. I appreciate you coming in this morning.
All right. Thank you.
All right, we are on Coffee Talk. We have got our pet of the week sitting out there. I see a little pink bow, so I'm going to say there's a little girl out there. She looks so cute. I can't wait to meet her. We'll be right back.
Here's your WPKY Weather Edge Weather Center forecast.